Taenia cysticercosis is a zoonotic disease due to a parasite called Taenia solium affecting pigs and humans. The burden of this disease is important in Madagascar, both for the pig's value market, especially for small farmers, and for public health, as cysticercosis is the main cause of epilepsy, which is very difficult to treat in remote communities. The project would allow a reduction of the incidence or eventually eliminate the porcine cysticercosis, a reduction of the incidence of human neurocysticercosis, and in doing so, a reduction of the economic and social losses related to these zoonosis. The pilot intervention area is in the district of Mandut and Betaf. The project has started in April 2021 and will run until August 2023. This project is funded by the Livestock Vaccine Innovation Fund, which is managed by the International Development Research Center, Canada. It is composed of a steering committee for strategic orientations, a technical committee for technical orientations, and 3 technical groups for implementation and studies: animal health, human health, and socioeconomics. It is coordinated by the University of Melbourne with 2 well-known experts, Dr. Merichel Donato and Professor Marshall Light-Tollers, who developed the vaccine against porcine cysticercosis and is the principal investigator of the project. They ensure the main technical assistance, the follow-up of the project, and lead the technical groups for each sector. Recognizing the importance of IOC's work through its SEGA One Health network, the WHO Department of Neglected Tropical Diseases and experts from the University of Melbourne reached out to the IOC Health Unit to join them in the project implementation. The SEGA One Health network, coordinated by the Health Unit of IOC, brings together more than 300 professionals in animals, human, and environmental health from different ministries. It has been supported by the French Development Agency since 2009 and by the European Union since 2020. With this network, the IOC can mobilize all necessary stakeholders and provide the required expertise. Consequently, the Veterinary Services of Madagascar, the Ministry of Health, and FOFIFA have been brought into the project. Being member in all committees, we also provide technical assistance and, most importantly, facilitate collaboration between stakeholders since we are experienced in intersectoral work. At the local level, FOFIFA is the lead actor, ensuring the daily monitoring of activities and is the main interlocutor of the principal investigator. Regarding the One Health approach, the interaction between different sectors is facilitated by the existing SEGA One Health network. However, it brings some specificities that expand the approach. In addition, the project breaks down the wall between operational sector, managing risk, and researchers, liaises the most advanced international expertise on the subject with local risk managers and even small farmers, promotes public-private partnership with an inclusive approach. The SEGA One Health network has just extended its structure by implementing a national One Health platform in each member state. In this framework, this project on cysticercosis was considered a good example of how to operationalize One Health. The challenge is to get a control method that is scalable, sustainable, and suitable for the context of low-income countries. That's why there is a focus on Madagascar's socioeconomic context using minimum effective intervention based mainly on pig vaccination. The goal is to provide the Ministry of Health and Vet Services with enough evidence and compelling argument to convince the government and its partners to take over and scale up the project and or turn it into a formal national program to eliminate this disease in the country. Results of this project are expected to be useful beyond Madagascar, as the model should be replicable anywhere.